Namaskar, I am Abhishek Srivastav and I am going to speak on the topic mental health, a health as well as a development issue. Friends, we can notice this very usually and casually in our life that we hear so many people saying, यार बहुत stress है, परेशान हो चुका हूँ. There is a lot of stress in life. So this word stress is used very commonly in our life that we don't treat it but accept as a very normal part of our life. But this whole stress word can have very abnormal effects in some normal person's life too. See how often this word stress comes in our life into our notice. We can gauge by this only that how often we do feel one of the biggest mental health problems. So if we come to the statistics, then this mental health would top the table of mostly unreported or underreported health issues. And this owes its practicality, its factuality to its stigmatization and underreporting. So if we have it in number then 1 in every 4 person suffer from mental health problem at some point of life, or even few of them at various points and phases of their life. So if you try to understand this whole thing with historical perspective as to why this sort of mental health issue is not being talked much in our society, why is it stigmatized, then you might find that earlier people did not talk anything about individualism. People even did not coin that word. People did not talk of individual interests. People did not know anything about individual privacy. But subsequently and generationally, individualism has found its quarter in the society. And if not pandemics like this COVID-19, the existing pandemic of social media and technological tools like WhatsApp, Facebook, Snapchat, Instagram, it has made already the people very far and distant away from the personal touch to being into a fake and virtual world of all level happiness through reels and snaps and stories and whatnot. See, the term mental health encompasses a wide variety of problems like stress, disorder, depression, to name a few common of them. It is viewed as a kind of disability, unfortunately, in our society. Now, what are the areas of concern? Number one, India allocates only 1%, mere percent of public health expenditure or budget for mental health problems. Number two, states with even good and better district hospital setup don't offer any kind of regular psychiatric outpatient services. Lack of infrastructure in terms of hospitals, services, and paucity of doctors there. Fourth, the stigmatization of the person receiving the mental health treatment as someone as pagal or asylum very carelessly. Fifth, social determinants of mental health like poverty, social exclusion, employment. These all factors are ignored here. So these were the areas of concern. So what are the solutions then? Number one, reliable and reasonable psychiatric condition offered widely. Number two, greater investment in mental health services by the governments. Number three, rendering vocational training to some patients who are willing to work and they are not able to find anything like their interest. Number four, more emphasis on community treatment. And number five, talks on nukkars, on chaurahas, on block level, on panchayat level, or even at the district or local level should be encouraged to sensitize the people related to mental health problems. So for this, from the government side, in 2016, Modi government passed the Mental Health Care Bill 2016, which offers something good in this direction, like banning electroconvulsive therapy without anesthesia, holding state responsible for training mental health professionals, and providing for supply of all essential notified medicines free of cost to the ones receiving medical treatment in terms of mental health care. However, there is a huge gap between the letter and spirit of the bill. Its implementation is just in the minds, in the loops. Activists also argue that this bill does not comply with the provisions of UNCPRD, United Nations Convention on the Rights of Persons with Disabilities. So this was on the government side. Now what we shall be knowing is that mental health problems can exacerbate poverty, it can reduce life expectancy rate, it can affect the development of individuals, society, nation or world at levels like this. Now let me come up with some hard facts to be here. Number one, 970 million people globally suffers from some kind or the other mental health problem. Number two, mental health workforce in India per lakh population comprises or includes of psychiatrists 0.3, nurses 0.12 and social workers 0.07. Remember that it is per lakh population. Now since these are the times of COVID-19, a pandemic time, so let me also list how this COVID-19 whole scenario has affected mental health at large. Number one, fear of being infected, ill and dying at the same time. Number two, powerlessness, helplessness and obviously the boredom. Number three, relieving other traumatic events of some other previous epidemics if you have experienced any of them. Number four, loss of employment, which is going to be the biggest problem this world will face later. And number five, isolation in terms of social distancing. It should not be social distancing, it should be physical distancing. So as is the saying, where there is a problem, there is a solution, there is a way to it. So here's the way listed by a renowned doctor in this field of mental health care, Dr. Vikram Patel. He professed the idea of tar shifting, the model of shifting of treatment of mental health care at the primary health center level. So what he advocates is not the centralized pool of mental health care system, but decentralized central healthcare system. So let's make this whole process of treating mental health care as Sundar, where S stands for simplifying the message, U stands for unpacking the treatment, D stands for delivering it to the people wherever they want, and A stands for affordable and accessible, and R stands for relocating the human resources. This whole concept of mental health has to be dealt with very sensitively and very cautiously. This is a very big problem India is facing right now. So we must face it, we must recognize it, we must treat this. Thank you and have a nice day.